Let's focus on health now, and tonight a shocking development from the very heart of Kenya's public health system. NTV has obtained an internal memo dated just 2 days ago, the 22nd of July 2025, from the Kenyatta National Hospital, the nation's largest and most crucial referral facility. This directive could fundamentally change who gets life-saving medical care in our country, effectively putting a price tag on admission before treatment. Sharon Momanya reports on these exclusive details.
For millions of Kenyans, Kenyatta National Hospital isn't just a building. It's the very apex of our healthcare system, the last resort for complex and critical care. But a new internal directive from within these very walls raises a troubling question. Who will be left behind when access hinges on cash? Dated just this week, July 22nd, 2025, an internal memo from the acting Chief Executive Officer, Dr. William Sigilai, addresses a critical change in patient admission policy. The directive states, and I quote, "Effective today, all patients presenting for admission without a valid SHA membership must be required to pay the admission deposit for medical cases or the equivalent SHA surgical package cost prior to receiving service, unless it is an emergency case." End of quote. This means if you don't have a social health authority cover or the cash to pay upfront, your path to treatment at KNH just became a steep, perhaps impossible climb. To understand the gravity of this, we must look at Kenya's established health referral system. KNH, a level 6 facility, sits at the very top. Patients are typically referred here from smaller dispensaries, health centers, and county hospitals for specialized care that cannot be provided elsewhere. The Social Health Authority, or SHA, Kenya's new universal health coverage system, was explicitly designed to integrate with this system, ensuring that once a patient is referred, their financial barriers are removed, allowing seamless access to the next level of care. But for the millions of Kenyans who, for various reasons, are yet to enroll in SHA or whose memberships are not yet active, perhaps due to poverty or the complexities of a new system, this memo creates an immediate and potentially deadly barrier right at the very pinnacle of our health system. It implies that even if you've followed the referral path, traveling from far-flung counties for specialized treatment, you could be turned away from KNH unless you arrive with significant cash in hand, even for serious conditions requiring urgent admission. Kenyatta National Hospital's new directive puts a stark choice before Kenyans: pay or suffer. And we ask, is this the path to universal health coverage? And what will the Ministry of Health do to ensure that no Kenyan is denied life-saving care simply because they can't afford an upfront deposit? Sharon Momanya, NTV, Nairobi.